particularly in terms of risks and complications. Do different approaches come with different risks and complications?
Yeah, I mean, in general, I mean, around the hip, I suppose you can broadly say there are maybe three approaches. So there's a posterior approach, the sort of the direct lateral approach, and an anterior, what people tend to refer to as a muscle sparing type approach. And you know, historically, people would have said that, well, maybe the posterior approach has a slight higher risk of dislocation, although many recent studies have shown that maybe isn't the case. A direct lateral approach, you know, certainly, you know, takes more muscle off the bone to do the approach, and there's the risk of that not healing back on, probably a higher risk of maybe limping after surgery with that approach. The anterior approach, you know, which is sort of gaining a lot of popularity, particularly, you know, in America and in other parts of the world, very popular. You know, that's very obviously very good approach, but maybe there's a slightly higher risk of, you know, quite minor nerve issues with that. There's a very small nerve that supplies the skin sensation at the front of the thigh. And that's quite commonly, you know, not, it can be quite stretched or whatever afterwards. And so a bit of a numb area at the front, you know, is a not uncommon, you know, complication following that. And one of the other issues with that approach, particularly in someone who's not really, you know, au fait with it, or is perhaps learning or whatever, you know, it can be more difficult to get exposure and to get the right angles of the implant. So complications such as fractures around the implants when putting them in might be slightly higher, you know, in some studies. But again, it's, you know, it's very specific to the surgeon, the unit they work in, how they've been trained, what they're familiar with, and the patient that's there in front of them. So, you know, these things are very, very general.
Yeah.